Welcome to Pivotal People. Today we're delighted to introduce you to Derek Breingan, who is the Head of Healthcare for Virgin Money. Thank you very much, Derek, for joining us today. We're really pleased to have you here. We'd like to talk a little bit about what you're doing at Virgin and a little bit about what you're doing now. Just tell me a little bit about that, where you are now and what sort of things you're doing.
Yeah, good. It's great to be here. What we're doing just now is we're really just continuing to build our lending book, supporting customers in health and social care across quite a broad spectrum, which has probably changed quite a bit since I started doing it. So everything from children's services to SEN schooling, right through specialist care for young adults, complex needs, mental health, physical disabilities, up to elderly and palliative care with dementia and specialist care. We're looking at doing some senior living, retirement, community funding as well. And the team are very busy because there's a lot going on. So we've got 22 of a team. We cover the whole mainland UK.
Yeah.
And we're doing fine.
Yeah. It's always amazed me as a carer at heart, I suppose. My background's care home manager and regional director. It's always amazed me the knowledge you, as I would call you a banker,
Yes.
the knowledge you have on the sector and the stuff that you understand and really get about what we do. And it also amazes me why somebody in banking, the lawyer, all those people choose care. And what I'd love to do now is just take you back to where you started and just tell me a little bit about you growing up, about your education and your qualifications and sort of how you got to where you are now. Yeah?
Okay. We go right back. I was born in Aberdeen. My mother was still effectively a school child back in the late 60s when those things happened.
Absolutely.
And I was taken into care as a consequence of that, and I was effectively into the care system. Ultimately, I was adopted by a family or a couple, and I went to live with them and brought up with them. The story was that I was always explained about the fact I had come from that background, so I always had that knowledge from day one. But I became very close to my grandparents, who had a very strong attachment to having this baby in the family. So I started to get on really well with older people, and I've always had that relationship with the older generation. So anyway, move forward, go through school. My father, who was quite an influence in terms of where I've ended up, suggested that I might be wise to go and find myself a job rather than go to university and find drinking women, as he put it. So I went to see the local bank manager back in the day. And
we had bank managers.
We had bank managers, and he was a bit like Captain Mannering for people that remember that. And he offered me a job as an office boy in the bank. So I started making the teas and the coffees and doing the shopping for the girls behind the counter and all that. And I just basically ended up doing multiple jobs through banking. One place after another, different divisions, different areas, private banking, corporate banking, really broad actually, which has been really good for me. Ended up at RBS, who wanted to start a healthcare sort of proposition.
When was this? How long ago was this?
Gosh, this is probably 20 years ago.
Okay, yeah.
And I had just joined RBS in typically business development sales, and I was the last guy in the door. Nobody else wanted to do healthcare. It seemed like a tough gig. So they just said, you're doing it. So I went away and just thought, I need to learn more about this in detail, and spent time out in the industry just meeting people that do it day to day. And that's where I started. Really enjoyed it, just took to it.
And you'd also have that empathy, that real empathy of having insider knowledge into the care industry, I suppose.
A bit. I think I'm more aware of it and the impact it can have, both positively and negatively. So that would have a bearing. But through it I met a lot of interesting people, and I became more interested in how businesses operated, whether it be dentists, whether it be a pharmacy, whether it be a care facility. And I started to mix in that community. I started to find that was a happy place for me to be. I got on well with the people. They seemed to have the same thought process, the same social compass and moral compass, and I just felt really comfortable. So I thought, if I want to do something with banking, this is what I want to do. So the RBS thing went well. Yeah. It was a very successful time, but we all know the story about RBS. And the Clydesdale Bank, who were quite a small organisation at the time, said, we want to start looking at potentially doing something a bit more focused on sectors. Would you come and join us? And I hesitated for quite a while because I was going into the unknown, but I thought, you'll not get a chance in your career to go and start something else from scratch. Yeah. So I did. And they were very supportive, and they gave me time to get my feet under the desk, understand how they operated, and then start to educate them, the stakeholders, in what this business market's all about. And that's really where it started. And then we've just grown slowly, steadily, made sure we're 100% focused on the sector. We don't deviate, we don't get involved in other things, concentrate fully, and make sure the people that have joined the team through the journey have the same outlook, the same focus, have the same passion, have the same empathy, and that they get a lot from doing what is banking effectively. Yeah. And as part of that, they educate themselves and immerse themselves in the sector, which is really important. And I think there's benefits personally as well as from a business perspective, because at the end of the day, we all touch social care, we touch healthcare at some point, and therefore it's good to understand how that works.
It is. And I think the fact that you're actually going into care home, I mean, you've been into a care home today, I understand.
Yes.
You're actually in care homes. You see the outcome of what you're doing, which is fantastic. Tell me a little bit about the visiting of going into the care homes. When the first time you ever went into a care home, can you remember that?
I would have been in care homes visiting my elderly grandparents when they were poorly. And then I spent most of my time starting learning dentistry and pharmacy, because they're quite complicated businesses unless you're in. So I'd spend time in those, and then the care homes kind of followed. I had a particular customer who became still a close friend, who asked me to go in to see his services because he was wanting a bit of advice. Yeah. And that's when I really got into understanding operations, spending time with him, seeing how the business actually worked, how the funding comes through, how do you get your residents, how does the local authority commission beds, what happens in the hospital when somebody needs a bed. And you really start to find there's so much to learn. And that's the best part of the job, actually, is going out and seeing how things work or how things don't work in different parts of the country for different types of clients. I was in a children's home last week in the Midlands, and I spent time with the staff, and I spent time with a couple of the children that were in their care. And yesterday I was in an SEN school, and again I was learning all about how you intake pupils into some of these settings. It's not just a case of turning up with your school bag and you walk in the door. There's so much work goes into making sure it's the right school and it's the right pupil sitting with the right pupil. And so it's really interesting.
Yeah, I bet it is.
Really
and actually to be able to do that and support them financially as well, to be able to support them financially and to be able to make those financial decisions around real life. You've actually been in there and you've felt it and you've seen it before you're actually giving them any money and before you're investing. That must be really, really rewarding for you.
It is rewarding. I think it's very important though that you understand
yeah.
the businesses that you are involved in, and you maintain that relationship, because that's important when it's going well and when things might not be going so well. And I think we've learnt from that was one of my customers, James Rycroft from Vida Healthcare, won't mind me saying, but he said to me a couple of weeks ago that when the pandemic started and we'd contacted customers and he'd got a phone call to say, listen, don't worry about the banking. That's the last thing you need to worry about. We're here. Yeah. We're not going to, you just don't worry about us and we'll look after you. And he said that was one of the most, the biggest relief he got was that phone call, despite everything else going on.
Absolutely.
Knowing that he didn't have to worry about that.
Yeah, it was a real challenge and a real, I've been in care a long, long time, and that period of time is something that we've never experienced before and hopefully never will again.
No.
So how did that time affect you from your company, from a business point of view?
Well, our sector was one of the few that probably still continued to operate as fully as it could do during that period, whereas others, hotels, the licensed trade, retail, they really had a massive impact. So the team and myself were really busy because we were talking to customers regularly about what the financial impacts of all this was or could be. We were busy the whole period of the pandemic, which is maybe not a bad thing.
Absolutely, yeah.
But we were hearing quite a lot of things that were quite upsetting, and we really felt you felt helpless because you'd been in some of these places and you knew these people, and yet here we are today. The sector has come out of it very resilient, remarkably, and is now starting to move on to the next phase. So it's had the best health check.
Yes, I suppose so.
To prove that it's robust and it's needed, and that it will continue to be needed. So
it's nice to know. So going on from that, where do you see the future?
Well, the future's probably twofold. You've got the demographic issues that we know about the ageing population, and we've got, unfortunately, a lot more people with a lot more complex conditions at a younger age and in childhood. We've got an issue with societal approach to children. Unfortunately, there's 110,000 children in England at the moment not in a family setting and are in care. That number's growing every year.
It's not easy if you want to adopt. I know somebody who wanted to adopt and just couldn't.
It's not easy. It was too easy when I was adopted. There wasn't much needed to be done then, frankly. It's a big thing for society, the whole social care and healthcare piece. So it's going to need investment. It's going to need funding, and it's going to need financial support from lenders and from investors that see it as a long-term needs sector.
Many years ago, it was quite a profitable industry just to have one little care home with a few people in it.
Lifestyle business,
And now, we've just had a 9.5% hike in minimum wage and about 4% hike in the local authority fees, and that squeeze gets tighter and tighter. What do you think the care homes particularly can do to try and manage that squeeze? I mean, I know we've got digital transformation now in most care homes, and I know working in care homes on the ground, I can see how much time that saves. How do you see that squeeze being managed, that financial squeeze that they're suffering? How do you see them managing that in the future?
It's got to be collaborative with stakeholders, commissioning of care, the cost of care, how the government finances social care going forward, NHS discharges, all the things we know about. They need to be progressed at speed, I would suggest. And on the operational side, I think it's tough. It means you've got more focus on costs and controls and wastage, and paying people fair wages, and there's a whole lot of things to consider. I think post-pandemic, a lot of businesses are in a better shape. And I know that might sound a bit controversial,
I understand totally,
but I think the focus on a lot of these things has come really first and foremost. So we've seen quite a lot of different differences in how people are operating. They're much sharper, much more on the floor, in the detail, understanding cash flows, and just being a bit more robust in commissioning as well.
Definitely.
I'm sorry, I can't take that resident at that fee rate because that doesn't work.
Absolutely.
And it's having that confidence to say that and not feel that you're putting your business at risk.
And if everybody does that, if all the providers are strong with their, we are worth more than that, we're not taking that person in, then eventually things will have to turn.
Hopefully. And unfortunately, local authorities are starved of funding at the moment, but we've got some local authorities who seem to be paying very strongly on terms of fees, and ICBs who are actually saying we need those beds and therefore we will pay you the private pay rate to make sure that we can unbed block. But it's not across the country. And
no, it's not. It's very
problem.
Postcode lottery the
that's
way that.
The problem.
Yeah, it is. But hopefully, in the future, things will improve. Yeah. Okay, that's been a really interesting talk with you. Thank you so much.